going to do a very quick introduction before moving on to the presentations, and then hopefully what will be a really fruitful discussion with you all. So next slide, please, Teresa. Thank you. So we run the South West Learning Disability Collaborative, which is funded by South West NHS England Learning Disabilities and Autism programme. So our aim is to improve the lives and the outcomes of people with learning disabilities. And we do this through workshops and like this one and webinars, by sharing resources and facilitating introductions and just generally supporting and spreading good practice. And whilst we are based in the South West, we do collaborate with individuals and organisations across the country, and we welcome anyone to join us. So feel free to use that QR code there to link up to our mailing list, so you'll get our newsletters and you'll hear about any future events. And I'm going to hand over now to Alison. So this is Yes, sorry, a bit of housekeeping before I hand over to Alison. We are recording this bit of the workshop, so we'll record the 2 presentations, but then when we get to the general discussion, we'll stop recording. So hopefully everyone will feel free to just join in the discussion, turn your cameras on if you're comfortable with that. In the meantime, please use the chat function. If you could introduce yourselves, that'd be really helpful. I know some of you know each other already, but if you'd like to pop your name, your organisation, in the chat and your role, and also if you are happy to be contacted on behalf of yourself or any groups that you may be a part of, please do put all of that in the chat, and then we'll be able to share that with everybody afterwards. So thank you, and over to Alison.
Thanks very much, Susie. And so I may have met some of you. I think I've met quite a number of you, but a little bit of context behind myself, the Learning Disability Collaborative, which will helpfully explain why we're doing the workshop. So I'm a GP by profession, but I've also got an interest in people looking after people with a learning disability. But I've, in addition, got an interest in research. I've published quite a lot with NIHR, ArcWest. And another part of my portfolio role is I'm a trustee at the Brandon Trust. And some months ago, I was asked about some challenges with ethics of including people with a learning disability in research. So I started asking questions. I was introduced to the Research Engagement Network, and particularly Anna from Leeds, Anna Anderson, and to broaden the discussion. And we had a meeting in September, a group of us, and realised that there's loads of good practice out there, but actually we don't all know what's going on. So Anna and I suggested having this meeting with the rest of the group so that we could, could we go on to the next slide? We seem to have gone backwards. So that we could actually work what issues there are for everybody being involved in research that includes people with a learning disability. We could start to look at possible solutions and then share ideas about working with people with learning disabilities and how we could take this forward. Next slide, please. So what we thought we'd do is just quickly start with a Slido. So if you hold your phones up, I'm sure most of you are aware of using Slido, but if you can look at the QR code, we thought it might be just helpful to have a shared idea of what challenges people face when undertaking research. You don't need to write too much, but perhaps just a few lines. It will be anonymous, but it'd be helpful to see what themes there are coming up, what challenges people find. Is it on consent? Is it getting it through ethics committee? Is it finding people with lived experience to be involved in your research? Have we got any other suggestions as to what? Got a couple of people typing. Anybody else got some ideas just to see what challenges? And I can see, and Karen, I can see Karen Coleman. Thank you, Karen. I've worked with Karen. We're developing research, doing some work on research on healthy weight for people with a learning disability. Interesting, finding people with lived experience. That's definitely something that is a theme that we could help. Designing appropriate materials, funding. So lived experience, that's helpful because we've got quite a few organisations here that, this is an opportunity we found looking at some work that's been done in the West Midlands of identifying organisations with people with a lived experience of a learning disability who would like to be involved in research and making the introductions to the academics. Consent, definitely an issue. That was one of the issues with the ethics committee. How can we ensure that people who are involved, it's informed consent? research materials. Okay, that's helpful with a range of learning disability severities. That's helpful, and certainly will be able to help you. That's something we've got. Approval of patient information leaflets. That's helpful already. Everything that's come up is things that we've got. So we're going to keep this open, and we'll come back to it later, because it may well be that you'll think of something else as we go, but it's interesting looking through already, giving researchers time to implement meaningful support. Absolutely right. I don't know who put that one in. You do not want a tick box, do you? You want to include people properly. Ethics application. Yeah, we need to, perhaps that's something we need to look at. So thank you. That's really helpful to know that what you're saying, none of this has come as anything new. And so feel free to add, so we can expand. Susie and I will look at the themes and share the issues that you've raised. But what I'd like to do now is hand over to Anna to really talk about some pockets of really good practice going on, because that's what we found, that there was some great work going on, but do you know about it, and how could it help you in your work? Over to you, Anna.
Great, thanks Alison, and thanks so much everyone for coming. So as Alison mentioned, I'm Anna, I'm a physio by background, and I work as a project manager and research fellow at the University of Leeds. And I'm particularly interested in how we can make health and social care research across all areas more accessible and inclusive for people with lived experience of disability. So today I'm going to be giving some quite broad background initially about inclusion in research, and then highlight some examples of good practice specifically around working with people with learning disabilities. So first of all, I just wanted to clarify what we mean when we talk about an underserved group. And that's a term that's been advocated by the NIHR's Include project. And that highlighted there isn't a single definition of an underserved group, but some characteristics that are common to many underserved groups include lower inclusion in research than would be expected from the population estimates, having a high health burden that's not matched by the volume of research for the group, and having different responses to engagement with interventions, with research not accounting for those factors. And we know that people with learning disabilities very much meet these criteria. For example, SWLDC reported in The Lancet in 2020 that they'd reviewed over 26,000 NIHR studies and found 60% actually excluded learning disability groups. So then thinking about why we should include underserved groups in research, there are many reasons, such as moral and ethical reasons, scientific reasons like making sure results are generalisable, equity-related reasons, and legal and human rights reasons, including the Equality Act 2010 and the United Nations Convention on the Rights of Persons with Disabilities. And then thirdly, in terms of when we should include underserved groups, that's of course across the research cycle. And the NIHR is actually introducing new requirements for applicants to demonstrate how inclusion is built into the research question and design, the participants recruited, the research methods, and dissemination. So the big question that I've not really included on this slide is how we can actually go about improving inclusion of underserved groups. And related to that, I just wanted to mention a NIHR-funded public involvement project I was involved in. And that's the next slide, please. Super. So this involved the 4 community organisations and 2 university teams shown here, and it involved holding community conversations with a diverse range of groups who'd often be considered underserved by health research. And the community conversations were really to provide an informal space to chat about health research, including barriers to being involved, and also how we could work together with the groups going forwards. So this project was underpinned by a knowledge mobilisation approach. And just for anyone who's not familiar with knowledge mobilisation, that's around research teams and people beyond academia sharing what they know with each other. And the idea is that that can enable the people working together to co-create new knowledge that makes a practical difference in the real world. And you can see from this figure that we were sort of conceptualising knowledge mobilisation, inclusion of underserved groups, and public involvement as 3 distinct but interrelated concepts. So then on the next slide, we've got an illustration here that was from somebody who attended the Leeds Involving People community conversation. And I think it's really capturing how the groups had a real willingness to be involved, but they felt they weren't represented at present. So they felt there needs to be a new path, which is flexible and tailored to diverse groups' needs. So across all the community conversations, we developed 3 take-home messages. These were ensuring relevance, appreciation and trust, prioritising language and accessibility needs, and maximising flexibility in all research-related activities. So one of the suggestions that came out of this project was that it would be helpful for research teams to have disability awareness and accessibility training. So that led on to planning an NIHR Advanced Fellowship application. Next slide, please. Great. So this is around planning how to co-develop, implement and evaluate what we're calling include disability resources. And the idea is that they would help to make health and social care research more inclusive for disabled people. So as part of the discussions for preparing that grant, I was introduced to people from the Research Engagement Network programme run by NHS England. And along with various other people, we've been holding some informal meetings to discuss how we can improve inclusion in research for people with learning disabilities and autistic people. And there's been real enthusiasm to keep that group going. So we're aiming to establish it more formally with a space for sharing resources as well as the informal meetings, and also opening it up to anyone else who's interested. Other discussions linked to my fellowship have led to establishing a global disability inclusion in research collaboration, which has been really valuable for learning from all the sort of good work that's going on in other countries. So what I wanted to move on to next is highlighting the examples of good practice related to including people with learning disabilities in research. And these slides are based on information that's been provided by various different teams who are all represented today. So there'll be a chance to sort of ask any questions about these projects later on. So firstly, I wanted to mention the West Midlands Learning Disabilities Research Network. And this is a collaborative initiative between organisations for people with learning disabilities in the West Midlands and the West Midlands NIHR Regional Research Delivery Network. The aim of this network is to expand opportunities for involvement in high quality research studies for people with learning disabilities. And key areas of work include reaching out to organisations for people with learning disabilities so that they can join the network and find out more about the relevant research opportunities, sharing opportunities with people with learning disabilities, and working with researchers to raise awareness of the network and encourage research teams to register their studies with the network. And the network are also working towards developing a visual resource to explain research and the research process in an accessible way for people with learning disabilities. So then the next project, we've got a nice bright slide here. This is provided by Amy Russell, focused on the No Research About Us Without Us project, which is led by Amy and Gary. And this project involves people with learning disabilities as leaders and co-applicants. And the team are planning to share practical advice on how to make research more inclusive, including how they rewrote a clinical trial to show how it could be made more inclusive, and also their top tips for working together. So this project is part of a portfolio of work for Amy and Gary. And Gary is an advisor on multiple research projects and has a real passion for improving inclusion of people with learning disabilities from diverse backgrounds in research. Amy's a researcher from the University of Leeds who's worked on improving diabetes care for people with learning disabilities. And when Amy was recruiting people to the diabetes research, she realised sort of how much of the way we do research needs to change because of the real sort of challenges she had around that. And Amy is also carrying out a fellowship called Capacity, Consent and Autonomy, and that's exploring barriers to ethical approval for research that includes people with learning disabilities. So that ties in with the next study I wanted to mention. So this is the HIPPY trial, and this is led by a team from the University of Bristol and is aiming to find out which hip implants are the best ones to use in people aged under 70. So the team are really keen to ensure that people from diverse groups had their voices heard in this project. So they worked with the Brandon Trust Adventurers, who are a group of people with learning disabilities and/or autism, to co-produce an accessible information sheet. And the plan was that this accessible information sheet would be provided to all potential participants in the trial as part of a kind of layered approach. But unfortunately, that suggested approach was initially rejected by the Research Ethics Committee. The HIPPY team then challenged that approach, and ultimately that decision was overturned, and that was particularly based on providing evidence from the Brandon Trust adventurers and also the main patient and public involvement group for the HIPPY trial, who felt that the suggested approach with the accessible leaflet and the layered approach was the best one to take. So just moving on to the next project. Great. This is a slide that was developed by the Brandon Trust adventurers and provided by Andrea Bruun from UWI. And this is a separate project that the adventurers were involved in. And this came about because health professionals have reported being nervous and lacking understanding when communicating with people with a learning disability and or autism, which can contribute to overprescribing of medicines and poor quality care. So to help address this, the adventurers and university researchers worked together to co-produce communication training to be included in the university prescribing course. And after the training, over 800 prescribers reported improvements in their communication skills with people with a learning disability and or autism. And the adventurers also reported benefits, such as that they gained a better understanding of the healthcare system and valued being advocates for people with a learning disability and or autism. So just before I move on to summarising the key take-home messages on the next slide, please. Super. I've got some acknowledgements just to say a really big thank you to everyone who's been involved in the projects I've mentioned in any way, and also particularly to say thank you for people who've provided information for their slides and the slides directly. We've got a few key references on this slide, and then we'll be providing a more detailed reference list after the workshop. So last slide, please, just to highlight our take-home messages. We know that people with learning disabilities are an underserved group in health and social care research. So people in all research teams need to be taking positive actions to improve inclusion across the research cycle. And working together with people with learning disabilities is key at all stages. So I'm really pleased now to be able to hand on to Andrea, because Andrea is going to be talking about how we can actually go about working with people with learning disabilities. And we just wanted to mention that ideally we'd have hoped to have had somebody with lived experience presenting. Unfortunately, that wasn't possible with the timing and structure of this workshop, but Andrea is going to be sharing some videos from some of her colleagues with lived experience, so that will give some really valuable insights.
Thank you. I'm going to see if I can share my screen now. Do I need to do something specifically? Just to make sure. But then, yes, brilliant. Thank you, everyone, for first of all inviting me to come and do this workshop with you. I'm very excited. As you can tell, the program is brilliant. So, sort of building on what Anna just said before, I'm going to talk specifically about how we've been including people with learning disabilities in our research. And the research that we're doing is all about palliative care, end-of-life care. And as you saw, I'm from Kingston University. So I'm going to talk you through our latest project and how we've been involving our researchers throughout that project, really. So let's see if I can get it to work. So the project I'm going to talk about is called the Victoria and Stewart Project, which is the very short title of this very horribly long one, but I'm going to read it out for you anyway. Co-designing a toolkit of approaches and resources for end-of-life care planning with people with learning disabilities within social care settings. So again, obviously we need to shorten that down. And again, because we have some brilliant researchers with a learning disability on the team, they're very good at making titles and words much more accessible and make it just sound much more, sexy in a way, because no one wants to say, this long title. But this project has really been sort of like co-produced from the beginning, where we've been working with two big learning disability service providers, McIntyre and Dimensions. And then together with other universities, we've really been trying to create this toolkit for people with a learning disability. Let's see if I can continue with the slides here. So we had 4 people with a learning disability employed as researchers on this team. And this is something that my boss, Irene, here, she's in the picture to the left, has really been advocating for, that to make sure we have money so people can really be involved, as Anna said, from the beginning throughout the research cycle. So again, this is not a one-woman show at all. And as Anna said, I would have loved to bring my colleagues, but they don't work on Mondays. And I'll talk a little bit more about later on. But I thought we'll just start off by hearing what they actually think about what it's like to be a researcher. So I have a little video and then I'll take it from there.
Hi, I'm Leon Jordan.
I'm Amanda Cresswell.
I'm Richard Keegan-Vaughn.
I am David Jeffrey.
We are
researchers at Kingston University.
I have worked here a couple of years now.
I have been a researcher for more than a decade. We have given lots of talks about doing research together for people with learning disabilities to help them in their lives.
I am new to the job as a new researcher. A few years ago, I did a research course here. And I helped write an article on this particular subject.
I started my new job as a researcher just a few months ago, but I have been advising on research about dying for quite a few years.
We are part of the researchers at Kingston University working on different projects.
I think people are so surprised that I can do research and help people, and they don't think that people with a learning disability can do things like this.
We're talking about people with learning disabilities, so we've got a learning disability, so we're the best people to be able to tell people about people with learning disabilities. Yes, you could be asking lots of questions when really if you don't have us helping you, it's like that you're putting words into our mouths and that we're not saying what it's really like, you know, that
For people with a learning disability and doing focus groups and doing other groups, that they would prefer to talk to somebody else with a learning disability than somebody who hasn't got a learning disability, because they haven't been through the same things that we've been through, and they feel more comfortable talking to somebody that they can understand more than they don't understand. Not everybody will think of employing someone with a learning disability, and then other people can see, look, these people can work together as a team. Why can't we employ someone with a learning disability?
what I really like about this university is that people look up to us, not down at us, and treat us with respect. They do. Hopefully in 10 or 20 years time there'll be more people that hopefully we're leading the way and people following in our footsteps.
Absolutely. The disability community doesn't get the chance to shine, doesn't get to input then on it. They get the door slammed in their face and they're oppressed and they miss out. And they miss out, and they have very valid opinions, contributions to make.
We're a bit more than just a pat on the back, you know.
Exactly.
We can give a lot more than just a pat on the back.
Exactly.
We can be researchers
and get paid for it.
Right. So as you can see, it's really a partnership where we've been working with these people. But I'm just going to talk a little bit more through what that actually looks like, because I think we all sort of agreeing that this is probably the ideal way of working together, but what does that look like in practice? So just sort of like put in this table so you can see the different stages of the Victoria and Stuart project, which I talked to you about a few minutes ago, might be further away now in our heads. But the first stage of that project was to look at what do we know about end-of-life care planning already, where we did a scope review of the evidence, what is out there, what kind of plans, resources, materials. Then at the second stage of the project, we did loads of focus groups to understand what is end-of-life care planning, what should it look like, what are the challenges, and what are the facilitators. Then in the third stage, we worked together with people with learning disabilities and professionals and staff to decide what goes into the toolkit, what should the toolkit really look like, and develop that together. Then we tested out the toolkit and made some changes based on the feedback. And then throughout, we've been trying to share it really widely to everyone to make sure that they knew that we were actually creating this toolkit. But actually involving people started earlier than the official start date. So before May, Amanda and Richard, that you met in the video, they were part of developing the application, getting the money in the first place, and sort of like feed into what should the project look like. So if we start there, and this is sort of also what Anna said before, again, no research about us without us, and there's something to think about it as early as possible, how you can involve people and include them in your research. And just to bear in mind that inclusive research is expensive and time consuming, so it has to be costed in. I think, is it Richard or Amanda who at one point said that you might only get 1 point out of the people that you're working with during one working day, but that is really that necessary. You know, you have to have that point, and you might need loads of time to really get through what you're doing. So there's something about things you might think, oh, we can easily do this in a day, might actually take 2 days, 3 days. So time consuming, yes. And because it takes extra time, you need to also pay for that time. But it's important that you include people from the beginning to the end. And I think this has really been one of the strengths of this project, is that they've been costed in, you know, with a fixed term contract from the beginning. So they're in every week to really discuss the stages of the research. We've had people who come in a bit more ad hoc, and that can be very difficult to kind of, you know, get our heads around what we're actually doing. But if you're there every week, you also sort of like follow what's happening. And I don't think most of us, if we're only working part-time on a project, it can be a bit difficult to actually, you know, just really grasp where we're at. So I can really recommend just costing people in and having them on board throughout the project. And we're not going to talk too much on that evidence review, because that was done by the Open University, so we weren't really involved that much with that one. But while they were doing the scope review, our team was really busy sort of preparing for our focus groups. So we have 3 focus groups with people with learning disabilities, as well as loads of staff interviews. And here our researchers' job was really to help with developing and piloting how we were really going to do that. So how do we ask questions so they make sense to people with a learning disability? And especially because we were doing end-of-life care planning. So first of all, we have to deal with death and dying as a sensitive topic. How do we do that? Also, we might have to talk about something that's sort of abstract and very hypothetical, which can be difficult for someone with a learning disability, even for people without a learning disability, such as when would you want end-of-life care planning to happen? That can be very difficult for anyone to answer. So we're really busy trying to figure out how can we do that in the best way possible and trying it out together. So I'm going to show you another video about how that actually ended up looking in the end.
John and Amanda helped to run focus groups to find out their views on end-of-life care planning using fun methods like stories and games.
It's not an easy topic to talk about, so we always start with an icebreaker game, like the hat game. Everyone likes that. It makes for a good atmosphere. It makes it easier to talk to one another, and it makes it easier to work together.
Here is one of our research questions. When should you start planning for the end of your life?
We find out the answer by playing games, and here is an example. The what's in line game.
this washing line is a story of Bob, and it's the whole of his life. So when he's a baby, when he goes to college, when he lives independently, and unfortunately when he gets ill, and then when he has his funeral.
We used that, didn't we, to explain or to ask people when they think we should start to plan. So people put the different things of planning on the washing line, didn't they, when they thought it should be done.
Right.
Jan?
Oops. So I hope you got an idea about how we had to do this in a much more creative way. And you can see when we're doing focus groups, it's very messy because we bring in all, you know, all our hats that we have. I think we're getting a little hat budget for the next project because we just used lots of things. Again, we needed to be a relaxed atmosphere first of all, and maybe I could you could tell, you said some of the challenges was actually get people, you know, to your focus groups, recruiting people as participants. You also need to make sure when you get people into this space that is comfortable and it's nice and it's a safe space, so you can get people to contribute, because it's just difficult, and especially when you're doing death and dying stuff that we're doing. So they really helped us out with seeing what works. So helped us again create these different ways of asking the questions, and also running them together with us really. So you can see Leon is here and he helped out with asking the questions as well during the sessions. Then we're also analyzing the data together, and that can be done in many different ways. A lot of our analysis is really about talking together. So it's our job then, if we went out and did a focus group with staff, is to bring it back to our colleagues with a learning disability, and then we'll have a chat about what do you think. So staff said that it can be very difficult to talk about death and dying. What do you think about that? And then we're analyzing it together. So we have had like an analysis days where we had like a big matrix of all our focus groups and what each group had said, and then we're just really discussing it together and making sure that our colleagues get a say in what that means and if it resonates with them really. And here we have a picture of Richard and my colleague Sarah, where they're sort of like trialing a thematic analysis, just using pens in different colors. There's something about being very visual and being creative when you have to talk about these things, because words can be difficult, and most of the words will also be very jargony and just difficult to understand. So there's something about our biggest task is really actually to interpret and translate all the stuff we see in the data and the raw data, and make it accessible to our colleagues so they can really contribute, because dealing with the raw data would probably be very difficult. There's something about that translational gaps for us as researchers to really fill. Then we had the co-design group in the middle. So there's sort of like two aspects to this, where we had the co-design group where we had 9 people with learning disabilities, which included our 4 researchers. And then we had an online group with staff and family members and healthcare professionals all working together on what went into that toolkit that we ended up making. And there was the group of people with a learning disability where we had sort of our members of the group, they tested existing resources, you know, we found from that scope review I mentioned earlier, and they helped developing new ones. And then our team has sort of like a job in between those workshops to really test that the activities we were doing in that group again made sense. So they do a lot of like, okay, we want to make the group play this game, or want to ask them something about this. How do you think we should do that? Or if we made something up, we're asking them, do you still think it makes sense? Because often we think we've made a brilliant plan that we're going to ask the question this way. And then our colleagues are like, no, that doesn't work at all. And we have to, you know, change the plan. So everything is such a fluid process of really going back and forth, and we're trialing and erroring all the time. So we really need them to tell us what works, especially when we go out to, you know, talk to other people that's not part of our team. We really need to make sure we're doing it well. And then they help facilitating the workshops, helping us with the icebreaker games. So they're just part of, you know, running our events as well. And then with the online group, with the professionals and the families, they help feeding back what we were doing in the Monday group. So this group online, they had sort of like a different job where they were doing more of like the abstract thinking, and then they sort of like needed the feedback from what they were doing in the Monday group, really testing the existing resources. So they have helped us out doing that too. So in the testing stage, I was a little bit different because we trained staff to go out and use our resources and use the toolkit. So that was sort of a little bit like out of our hands as well, because staff were just doing it, you know, but instead they were sort of involved in creating loads of videos on how to use the resources. So you can see Richard and Irene being very busy creating a video about how to use My Funeral Cards, a resource in the toolkit. So they were sort of like, they were part of all the instructions and all these different things in the toolkit sort of in the background, but that staff would open if they needed advice on how to use it. So I'm just going to share a little bit of a video that they did on one of the resources.
I'm ready to plan my funeral. My whole family was cremated.
I would choose burial for now.
I think I'll be cremated, I think, yes.
When you're dead.
When I'm dead, yeah, make sure I'm definitely dead, yes, before they do it, but yes, I think that I'll be cremated, yes.
And there's one place I want to be in the Remembrance Garden with my mum, my dad, my nan, my auntie.
Before I die, I will change my mind and discuss it thoroughly.
I want to make sure that I'm definitely not going to be burned alive, you know, but definitely want to make sure that I'm dead, yes, so before they do that bit, yes. And,
When you're cremated, you can choose where you want your ashes to be scattered. I would like to go back to go back to Neasden, where I used to live, with my mum, and then scatter them on the lake. There's a park, and in the middle of the park there's like this great big lake, and in the summer we could have boats on there and stuff like this. So I was always like going swimming with my mum. And
I'm just gonna stop the video here because I'm running out of time, and it's a long video of them going through the whole resource, but it's on there, it's on YouTube, so everyone can see it, and you can see how we can use that to sort of also invite staff not to be so worried about talking about funerals, because you can see we're laughing a lot and they're quite beautiful conversations we have with our colleagues. The last bit of the process that our colleagues was involved with has really been presenting what we've been doing. So we've been doing webinars throughout the project. Here you can see Irene is chairing, and she's always co-chairing with one of our researchers. So here's David. We've been at the Hospice UK conference together. Richard is here presenting our poster in Rotterdam at a big palliative care conference. So again, we're sort of as much as possible doing it together, but obviously time can be difficult. They don't work that many hours. So taking, you know, a conference day out can mean that's almost like a month's worth of their time. So there's something about prioritizing and how can you do that in the best way possible. But we are doing it together. We're writing the papers together as well. So again, they're being part of the whole process, really. So that is all from me. You can find the toolkit here. And if you have any questions, just let me know. I'm going to hand over to someone else now.
It's me, Andrea. Thank you. That was absolutely fantastic. And I really appreciated the overview from Anna, you know, highlighting some pockets of excellence. But between both of you, I think you've got a number of themes. One is the opportunity for people with a learning disability to actively become involved. And I can see Rachel Roberts from the Brandon Trust, who was the person who asked me the question on ethics. But I was also really pleased to hear that Dimensions and McIntyre were named, and just thinking, what are the opportunities for organisations to become involved in? And that then leads on to one of the others, was the finances, Andrea, that you said that people with a learning disability should be included in part of the financing and the budgeting, and then people help get it's meaningful. As one of the colleagues said, it's not just a pat on the back, it's actually getting people meaningfully involved. And at every stage, you know, the planning the research, the undertaking the research, running the focus groups, writing the work up, and then telling everybody about it afterwards. So I hope people have found that as helpful as I've done. And I found it quite emotional, because it was I love the bit about the cremation. Can you make sure that I'm dead, please? And you think, yeah, actually, that's right. You know, as a doctor, that's what I've done, but how do we reassure people that that's part of practice? So I hope that's been helpful. What we'd quickly like to do is just go back to the Slido, because we asked about the challenges that people identified in undertaking inclusive research. And I wonder if now you've seen some of the presentations, whether you've got some additional ideas. So is it possible to put the Slido slide on again, Teresa, so people can just add in? So have you identified new challenges that we should perhaps could highlight before we go into the discussion and talk about next steps? You may have it open already. I'm just wondering if we can. Brilliant, here's the slide. So if you can put in, if you've got other additional challenges now that you've seen these presentations, any more ideas of what you're going to be doing, how you're going to be employing people, contracts, fixed term contracts. I was thinking, oh, that's an issue. The work at the West of England Learning Disability, it's like an introductory group. How could we have the introductions so that people who want to undertake research that includes people with a learning disability can register their interest, but how can they have that be confidently introduced to experts with lived experience to be involved? To see if we've got a couple of other things coming up. So I've got a new response, if it's possible to scroll up slightly. Teresa, it says there's a new response.
Maybe just to elaborate on the fixed term contract, which seems a bit, that seems maybe a little bit, oh, that's risky. That means it will end at one point. Yeah. But in academia, I'm also on a fixed term contract. So it's sort of like, I know it doesn't sound good, but most of us would not be on a permanent one anyway. So actually the fact that they are on one is the good part about it, and not just coming in sort of like as PPI advisors ad hocly, just to elaborate on that.
Thanks, Andrea. I'm married to an academic, so I'm very aware of it. Unfortunately, as part of an academic way of life. So yeah, sorry, it certainly wasn't coming as a criticism. I was just interested that you've got a contract, unlike the PPI. Oh yeah, workload of academics, dissemination to people meaningful. I think the videos are really useful, and perhaps Andrea, you could put some of the links to some of the videos for YouTube in the chat, because I think people will be interested in those. Yeah, supportive environment, because I think that's quite challenging. I work a lot with people with lived experience, as does Susie, who's the senior project manager on this one. And we're learning how to work with people. So it's not just, as one of the colleagues said, a pat on the back, and how we can learn. So I'm going to leave that open in the background. So if you've got some other ideas, please add them in. I think there is the option to vote for them. We could put that on. So if you could, I don't know whether the voting could be easy, Susie, for people to do in the background, or perhaps after the meeting, if you can have a quick look and highlight some of your what you consider to be priorities, that would be really helpful. But perhaps we could now open up to discussion and say any ideas, any suggestions that people have got. Oh, I've just seen, yeah, thanks. Wonderful presentation. I completely agree. And thanks, Andrea, for sharing the YouTube channel. So perhaps we could stop recording now, and if we could unshare the screen, and then perhaps people could put their hands